The information shared on Light Body Radio is for educational and informational purposes only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician, licensed healthcare provider, or qualified wellness practitioner with any questions you may have regarding a medical condition or health goal. Dr. Lara May, her guests, and affiliates do not claim to cure, prevent, or treat any condition and are not responsible for any actions taken based on the information shared in this podcast. By listening to this podcast, you acknowledge that you are responsible for your own health decisions and that any actions you take based on the content are at your own discretion and risk. Thank you for tuning in to Light Body Radio.
Welcome to Light Body Radio, where science meets soul and healing gets multidimensional. I am your host, Dr. Lara May, functional medicine pharmacist, master intuitive Reiki channel, and certified life and health coach. Here we decode root causes, transmute stuck energy, and empower your full spectrum healing journey, body, mind, and light body. This isn't just wellness, it's awakening, grounded in science, guided by spirit, and designed for your evolution. Let's rise and radiate. Welcome to the next level of you. Hello and welcome to Light Body Radio. I'm your host, Dr. Lara May, and today we are back with Wellness Illuminated, which just means it's me and you talking about whatever juicy thing I feel like talking about, honestly. But today we're going to be continuing our series in our peptides. So this is the 4th episode in our series about peptides. And we're actually finally going to get into the nitty-gritty and the specifics about specific type of peptides. So today we're talking about everybody's favorite, the most famous probably, that's GLP-1 peptides. But we're going to move well beyond weight loss. And we're going to talk about metabolism and the brain and inflammation and gut and hormone signaling, all that good stuff. So, of course, let's jump right in and let's really start to expand this conversation. This is not a one-dimensional chemical. It is much more complicated than just weight loss. GLP-1s are everywhere right now. And if you listen to most of the conversations, they are very much positioned and focused on weight loss. And that's because this chemical is very good at helping the body release weight. But that's only one piece of what's actually happening, because GLP-1 peptides are not just about fat loss specific. They are a system-wide signaling molecule. They influence metabolism, brain chemistry, inflammation, gut function, and even hormone balance. And like we talked about in the last episode, they don't override dysfunction. They depend on the body's ability to respond in a healthy way in order to function optimally. So today we, again, are, like we love to do here, we're going to blow this conversation wide open. And so it's not just what do they do for my weight loss or my fat loss, but it is what are they actually doing inside my body on all the different levels. So first, let's start with the definition of what does GLP-1 even stand for? What is it? And so it stands for glucagon-like peptide 1, number 1. It's a hormone produced in the gut in response to food. It already exists in your body. You never have to take any of the things that are marketed out there because your body is already producing this on its own. It coordinates how your body handles nutrients. It stimulates insulin when glucose is present, not president. It suppresses glucagon, slows gastric emptying. So if you're already a diabetic with gastroparesis, this is something that you need to be aware of, because it could actually make your gastroparesis worse. So that's also why these chemicals are very powerful and helpful, but they are not for everybody. And we're going to talk about that. But again, so slows gastric emptying, and it signals satiety to the brain, meaning it tells your brain when to feel full. But here's the key. GLP-1 is not a metabolic hormone. It is a communication bridge between the gut, the brain, and the endocrine system. And when that communication breaks down, that's when we start to see the symptoms that people start to struggle with. So weight gain, blood sugar instability, cravings, inflammation, fatigue, not feeling satiated and just eating and eating and eating because they're constantly hungry. So when we have maybe a deficiency in GLP-1 or a breakdown in the GLP-1 signaling naturally in our body, then these are the consequences of that. And eventually, if that blood sugar instability is left unchecked, it will develop into type 2 diabetes. So we know that. Okay. So now we have on the market both GLP-1s and what are now being called GLP-2s. So GLP-1, GIP, and what's coming is a triple agonist, and that one is called retatrutide, but we'll get there. So GLP-1 alone is appetite regulation and blood sugar stabilization. So that one will be, for the listening audience, just to connect the dots, that would be semaglutide. GLP-1 plus GIP, now we're looking at improved insulin signaling, better nutrient partitioning, and potential muscle preservation. That is tirzepatide. So that is your dual acting, or the GLP-2 is what some people are now calling it. And then the triple: increase energy expenditure, enhance fat oxidation, higher metabolic demand. And so this one is where we bring in that glucagon action. And so now we have GLP-1 acting with GIP acting with glucagon all together. And each level increases metabolic influence. And I would even venture to say that metabolic sensitivity in a good way. And so, but it also increases the need for clinical awareness and clinical support. And so this, I think, is really important too. I don't think these chemicals should just be taken without some sort of clinical supervision, because they're, again, I even just in the first couple minutes, I said, if you're diabetic with gastroparesis, meaning your gut is already slowed on its emptying, you have to be really careful with these drugs because it doesn't last forever. Your body essentially will adapt to it, but it does slow that gastric emptying. And that in one way helps your body feel full, that satiety signal to the brain. But it could also have undesirable consequences and side effects if you're one of these patients with diabetes and gastroparesis. So it's important to know about and take into consideration, and your practitioner should be aware also. Okay, so let's talk about inflammation. GLP-1 signaling has been shown to reduce pro-inflammatory cytokines. Now, we talked about that in the last episode. So these pro-inflammatory cytokines, the TNF-alpha and the IL-6, have been shown to be reduced by GLP-1 signaling. So that's great. They also can improve endothelial function, which the endothelium is a type of smooth muscle cell. And so that is really where we find the cardiovascular cells essentially are endothelial. So mechanistically speaking, GLP-1 reduces oxidative stress. It can improve mitochondrial efficiency, and it modulates immune signaling pathways. So again, just with this one aspect, we're already not even talking about weight loss, are we? I mean, again, weight loss is a happy side effect, but it is not the core function of the chemical that is already naturally occurring in our body. So this is one of the reasons we see improvements in metabolic syndrome and cardiovascular risk markers, and even some neuroinflammatory pathways. So even though you might have started taking this because you're looking for weight loss or because you're diabetic and you're looking for something else to give you that little extra edge and help your numbers, you're going to also find improvement with your cardiovascular risk scores. Maybe you also notice some of your other the inflammatory things that were happening in your body start to dampen down. And so the GLP-1 is not acting as a direct anti-inflammatory drug. It's improving metabolic signaling, which then reduces the downstream driver of inflammation. So instead of suppressing inflammation, it's actually helping remove the conditions that create the inflammation to begin with. So I want you to think about that. What I just said, that's actually pretty big. That's big, big, big. A lot bigger than just, oh, I'm going to, like shed some lbs. Okay. All right. So let's move on to the next thing. I want to give you a moment to digest what I just said. All right. So let's talk about gut health. And it is actually more than slowed down digestion. But so most people hear only about the slowed gastric emptying, but the gut effects go a lot deeper. And so this can actually be very impactful for anybody out there dealing with IBS or any sort of inflammatory bowel disorder. It can be helpful. So it's something to think about. GLP receptors are present throughout the gastrointestinal tract. That's where they naturally do their thing. So GLP-1 influences gut mobility, secretion patterns, and communication with the enteric nervous system. So your gut has its own little nervous system in there. And so the GLP-1s influence those communication pathways. By slowing the gastric emptying, it reduces the post-meal glucose spikes. It can improve satiety signaling, again, that signal that tells your brain you're full, and can decrease stress on the digestive system. But there's nuance here. In some individuals, especially those, and it's gonna sound like, well, you just said that this could be helpful, but now you're saying it can hurt. So everybody needs to approach this from an individual perspective with their individual practitioner. And this is why you need a competent, educated clinician to work with you on these things. But so if you're one of these people with already underlying gut dysmotility, so again, diabetic with gastroparesis, SIBO, gut sensitivity, IBS, IBD, the slowing, especially at the beginning, can create more bloating, more discomfort, more constipation. So again, this is not inherently good or bad. It's just context dependent, because the longer you're on the GLP-1, usually the side effects abate. So these are also dose-dependent side effects. So this is why, especially in the world of pharmacy, we like to say start low and go slow. So ideally, your practitioner should not be throwing you at a 12 milligram dose right off the bat. You should be starting at a low dose and titrating up based on your tolerance and the effect that you're looking for. So if the drug is started at a dose that's too high, then you're more likely to experience side effects that are uncomfortable, side effects that will make you want to stop the drug, or side effects that'll make you say, well, this didn't work for me. It just made it whatever worse. So again, it could be a dosing problem. And it also could be the combination of whatever is already going on in your body with the dose that was chosen by your practitioner. We talked about this in the last episode. Is your body healthy enough for these chemicals to help you? And again, it's not an automatic no-go if your body is not ideally healthy enough, but it does mean that the dose should probably start at the lowest possible effective dose. Now, that is not for me to decide, and I am not telling you what that dose is because I'm not your practitioner, so I don't know. But when you are discussing these things with your practitioners, these are parts of the conversation that need to be happening. So there's also emerging discussion around GLP-1s and the microbiome. So that whole environment within our digestive tract of microbes, of fungal cells, of all these little things that live and work together to create its own little community. So now we're starting, the longer that they've been on the market and the more we've studied them and gotten to understand them at a deeper level, we are seeing changes in not only glucose levels, but inflammatory signaling and changes in how the body metabolizes the different macros, meaning the protein, fat, and carbs that we ingest. And so the primary mechanism here is still neurometabolic regulation of the gut. I want you to think about that again, based on everything we've talked about so far. Neurometabolic regulation of the gut. Okay. All right. So now we're going to layer in something else. So now we're going to layer in the hormone balance because this is one of the most overlooked aspects. So GLP-1s do impact hormone balance, but it's indirect. It is significant, but it's an indirect mechanistic pathway. So let's walk through that some. All right. So again, our favorite little buddies here, insulin and cortisol. When blood sugar stabilizes, cortisol spikes decrease, stress signaling improves, and that grand old HPA axis dysregulation can begin to normalize and come back into a state of homeostasis. And this is huge for people living in chronic stress patterns. So if you're not sure what I'm talking about right now, go back and listen to the previous episode because I went deep into how all of these things work together within our body as sort of like an orchestra, either helping us come into a state of homeostasis or actually getting into these patterns of overactivity and possibly keeping in us in a pro-inflammatory state, which is not good. So what we're saying here, though, is that the GLP-1s, by helping metabolically regulate us, are also allowing our body to regulate these other pathways on its own. So it's an indirect, but it's significant. All right. So you with me still here? Okay. So the next piece are sex hormones. So we said we're going to talk about hormone balance. So now we're going to talk about sex hormones. So in insulin resistance, we often see increased androgens, disrupted estrogen metabolism, and irregular cycles in females and or exacerbated perimenopausal symptoms. And so by improving insulin signaling, GLP-1s can actually reduce excess androgen production, improve metabolic drivers of hormone imbalance, and support more stable hormone patterns over time. So you might actually see, if you had irregular cycles before, you might actually see them come into like a regular pattern every month. Or maybe you had like really bad cramps or pretty severe bleeding, you might start to see also that sort of start to resolve itself and dampen down and become what would be considered quote unquote more normal instead of so inflamed. And so, I guess for lack of a better term, like angry. All right. So there's that piece too. Again, all of these are indirect effects because of this powerful metabolic pathway. And so I just want you to keep that in mind. All right, so now we're going to talk about the appetite hormones. So GLP also interacts with ghrelin, which is the hunger hormone, and leptin, which is the satiety hormone. And so these are super important for appropriate hunger and fullness cues. And so while before you maybe started taking these, whether by, prescription or compounding pharmacy or whatever, and I'll talk about that later too. You might have noticed that you were constantly hungry, or you had trouble like knowing when you're full, or by the time you felt full, you already had overeaten and you felt like full and bloated and miserable. So for many people, some people haven't felt and had those appropriate chemical cues happening in their body for years and years. And so this can be a really significant change for them when they start to be able to like look down at their plate and go, no, I can stop. I'm full. I am satiated. That's huge. Not only for the body, but also for the mental health piece here as well. So when GLPs work well, it's because they're addressing all of these multiple systems at once. They're addressing blood sugar. They're addressing brain signaling. They're addressing inflammation. They're addressing hormone drivers. They're addressing gut-brain communication. So this is not just about reducing calories. It is not even anywhere close to eat less, move more, blah, blah, blah. We know that doesn't work. If that worked, then we would not have a problem with the massive obesity crisis that we have in this country. If it was really that simple, then trust me, like I know both professionally and personally people that struggle with their weight, and I've been there too. I have struggled. I have been, 30 pounds overweight in my life at one point. And it can be really frustrating and disheartening when you feel like you're trying your damnedest, you're doing the right things, you think you're eating right and you think you're moving enough, and you seem to be just like putting on more weight, like WTF. When you're in that situation, it's really frustrating. And so I want to point out that's why these chemicals are so powerful, because that has nothing to do with that bullshit. These chemicals are actually working in a multi-system approach with your body. That's why they're powerful. That's why they're effective. Okay. They are restoring regulatory balance to the body. And that's great. It's fabulous. So in general, I'm a fan. Let's just, for the record. However, there are things that can go wrong. And like we talked about a little bit before, these are not for everybody. And it's definitely not one size fits all when it comes to dosing and picking the right one, because we've already talked about how there's technically 3 different types of compounds now. And I'll just leave it at GLP-1, 2, and 3. Okay. So where we see problems is when protein intake is too low, you will have muscle loss, because even if you weren't taking these and you were on a successful weight loss path, you would be losing lean muscle. You wouldn't be probably losing as much lean muscle. And the research has showed with these chemicals, your body does lose more lean muscle than other avenues of weight loss. So it's really, really important to make sure you're getting enough protein, especially as a female, especially if you are over the age of 40 and you're entering that perimenopausal time. It is really, really important to make sure you're eating enough protein and lifting heavy things, lifting weights. That is what is going to prevent you from losing as much muscle mass. Muscle mass is metabolic. Muscle mass is a longevity marker. You need muscle mass to be healthy. You might need to, again, lose some lbs and some fat mass on your body, but you need to make sure that you're not losing muscle mass as much as you can. Another issue that we oftentimes see with these is the calories are dropping too aggressively. And when that happens, again, this is dose, it could be dose related too. So if you have really ramped up on your dose quickly, and or your practitioner started you automatically at a high dose, sometimes you'll also find fatigue and metabolic slowdown with that. If you're having metabolic slowdown, then you're not actually going to lose as much weight. And so your body needs calories to function. Your body needs calories to fuel ATP production. So you have to be eating food and you have to have your macros dialed in here. And so if you're working with a practitioner that put you on one of these drugs and then didn't talk to you about your nutrition and your macros, you need to go find another practitioner, because those two conversations should be held together, hand in hand, in the same visit. And so you should have a clear path and a clear understanding of exactly how much of each macro that you should be eating to maintain your muscle mass and not have too aggressive of a calorie drop so that you don't go into the metabolic slowdown phase. All right. The next piece is gut function. If your gut function is already compromised, then again, if your doses are started too high, your symptoms will be worse. You will feel crappier, and it might be so bad that you just do not want to participate in these drugs. So again, I think there's always a path forward. Start low, go slow. If your body says no, even at low doses, then these drugs might not be for you, unfortunately. But there might also be a way that you can, maybe the conversation of microdosing comes in here with your practitioner. There's a lot of debate over the whole microdosing approach, because there is a difference between microdosing, a low start dose, and then the macro, which is in theory like the goal big dose. So those three things are very different. Okay, and then the next aspect here is the nervous system dysregulation if it's unaddressed. So that means that your body is just not adapting to the changes with these drugs. And most of what I've seen, all of these things are dose related. So if the dose was started too high and or you're titrated too fast and too aggressively, your body is not having a chance to adapt and to recalibrate itself to the sort of like the reintroduction of the appropriate signaling. And so it's really important to give yourself the time. Everybody wants to, drop weight fast because they think it'll be their big solution, but there's really not. And especially if you've been carrying a lot of extra weight on your body for a very long time, there can be a lot of other consequences to your physical body by dropping that weight too much, too fast, too soon. So it's not always healthy to drop a lot of weight super fast. Just saying. Okay, so the GLP-1s, again, they're not a replacement for physiology. They are the modifier. They are the signal amplifier. And so I want to talk about just briefly here, the regulatory aspect of it. So these therapies have existed for many, 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 many years before Big Pharma got their claws into them. Okay. For many, many years, they flew under the radar. Again, these are chemicals that are naturally produced in our body already. So when you have those types of chemicals, technically, it makes it tricky when you're trying to patent them. Why do you want to patent a drug or a chemical? You want to patent a chemical so that a pharmaceutical company, a drug company can come in and monopolize it and market it and sell it for profit. That's why you need a patent, because it gives them exclusive rights to it for usually about 7 years before they have to either apply to extend the patent or it goes generic. So over the many years, we've had evolving FDA regulations within the field of all peptides, but especially GLP-1s. And then a few years ago, there was a drug shortage because the drug companies are so bad at maintaining healthy production facilities and pathways and records and all these things. They were fined by the FDA and they were told, you have to stop. If you can't do this the right way, the healthy way, the correct way, you have to stop. You're not allowed to. So in order to prevent the further shortage, because these drugs were already so successful from the big pharma perspective, big pharma actually asked the compounding pharmacies, hey, can you make these for us until we can get our act together and get our production facilities back up and going? And compounding pharmacies were like, yeah, sure, of course we can. But then they figured out like, oh, look how much money we're losing now. And so then they went back to the FDA and they said, make them stop. They're not allowed to do this. These are ours. We have the patent. They're not allowed to, do this without our permission. And so there's been this back and forth. So compounded drugs actually are legal. We do it every day. There does usually have to be a specific circumstance, a patient-specific circumstance, but that the legalese around this is very open and vague in general because we want patients to have access to effective treatments. And so this conversation could also be extrapolated into like the thyroid hormone conversation or sex hormone conversations. Like, think about all the things out there that compounding pharmacies actually provide to patients and the public, and in a bioidentical patient-specific way. I think that's important here too, is that there are advantages for a compounding pharmacy and a practitioner to use a compounding pharmacy versus just writing you a prescription for that thing that's already packaged in your local retail pharmacy. That's the difference. The local retail pharmacy, that big pharma owned product is, let's see, how do I want to say it? It's restricted to certain doses and certain packaging forms. That's where the patents live, and that's where they shine for these companies, in the dosing strategies and the packaging, the delivery mechanisms. But if you release all of that and you, with your practitioner, you go down a very personalized approach and administration approach, then that's where you're going to go more towards the compounding pharmacy path. So I think it's important to realize the difference there and how and why they're different. So how do we think about this moving forward? I don't think it's productive or good for any of us to remain myopic and just say, well, these are just about weight loss, and people that take them are lazy. They don't want to do the work to lose the weight, blah, blah, blah. No, to me, that's not even a valid argument for all of the reasons that I've just spent. I don't even know how many minutes I've been talking now, but however many minutes I've been talking, all the things that we just talked about in this episode and the previous one with all the pathophys and all the biology and all the explanation of how they work. You cannot now, if you've listened to these 2 episodes, now say that it is just about fat loss. It's not. So we need to see that and understand how the system, meaning our body, is being influenced by the chemical, which is the GLP-1, 2, or 3. What problem are you trying to solve with your health, with your body? Is this compound going to help it or not? Maybe you already have some significant gut dysbiosis or gut problems. Maybe this isn't the right starting point for you, and that's okay. And again, is my body healthy enough to respond well if I start ingesting this in some way, shape, or form? And so this is how we move out of the trendiness, the mainstream media aspect of it, and we really start to be intelligent about our own health, and how we want to approach it, and how we want to talk about it and approach it with our practitioners, and or if you're the practitioner, with your patient or your client. So I think we've established that the GLP-1s are powerful, not because they cause weight loss, but again, because they influence metabolism, inflammation, gut signaling, and hormone balance. And when used in the right context, they can help restore systems that have been dysregulated for years. When they are used without context, or without the appropriate follow-up, or without the appropriate, I think, attention to detail is a good way to say it, then they can also create imbalances just as quickly. If you lose too much weight too fast, if it paralyzes your gut, really not good. If you are one of these people that just wants it for weight loss, but you're not planning on changing anything about your diet or lifestyle, then go for it, but you're only going to get so far. And as soon as you stop the drug, all of your other problems are going to return because you haven't changed anything in your life or at really your baseline. So I think that's also important to point out and say. They can create imbalance just as quickly. So our jobs, I think, both as practitioners and possible consumers of these chemicals, is to understand the system. Because once you understand the system, meaning our bodies, our human biology and physiology, we can use tools like this tool in a way that actually supports long-term health, longevity, thriving, being healthy. And so I hope this episode has, again, gotten you thinking, gotten you asking questions, gotten you considering a lot of different things, not only about this compound, but, maybe about, the complexity of health in general. Because in the next episode, we are going to move more into some different types of healing peptides. And we're going to talk about more tissue repair. We're going to talk more about inflammation on a more specific basis. We're going to talk about brain health, mental health. We're going to talk about recovery. And I'm going to be throwing some more terminology at you, some terminology with some letters and numbers that you may have heard of, but you probably haven't heard of before. And they are just as powerful as the GLP-1s. They're just completely different. But I want you to know that there is power in these. And that's also why Big Pharma is trying to get their hooks into as many different ones as they can. And if they can't, then they're trying to get regulating bodies like the FDA to keep these away from you. Because unfortunately, and I don't think this is a big secret, Big Pharma doesn't want us to be healthy. Then they'd be out of a job. So anyway, I'm going to leave you there before I go down that rabbit hole. So I hope this episode has been helpful. Again, I hope it has prompted you to get curious and ask questions. If you have questions or comments, I would love to hear them from whatever platform you're listening to this on, or YouTube, wherever. Leave me a comment. If you think I'm a nutcase or an idiot, that's fine. You can tell me that too. But my motivation is to provide you with information and to stimulate your brain to ask questions and to think for yourself and to bring these questions back to your practitioner, to have these conversations, to help you be the healthiest that you can be on your terms. So with that, I will leave you back to your day, and we'll catch you in the next episode. Thank you for joining me on Light Body Radio, where functional medicine meets intuitive healing and transformation happens on every level. If this episode resonated with you, please share, and if you're ready to go deeper, visit drlaramay.com to book a functional medicine consultation or an intuitive healing session. Whether you need to rebalance your body, clear your energetic blocks, or reconnect with your soul's purpose, I've got you. You can also follow me on Instagram or TikTok at Dr. Lara May for daily inspiration, energy updates, and healing tools. Remember, your healing is multidimensional, and so are you. Until next time, honor your body, trust your intuition, and activate your light.